So what's being done to make sure vaccines in Madison are kept safe? It's a multi-layered system, as Naomi Coles explains.
St. Mary's Health and UW Health Hospital here in Madison are both major vaccine storage hubs. And this news out of Milwaukee has them both rechecking and double-checking their plans to keep their vaccines secure. Dr. Jeff Pothoff wasn't exaggerating this afternoon.
We thought of this more like an armored truck full of gold, rather than glass vials full of, clear liquid.
Which is why the case of an Aurora employee wasting more than 500 of those doses on purpose has healthcare workers concerned.
That's a pretty big number.
And evaluating their own security systems as a result.
Those areas are under 24/7 video surveillance. So, if you approach a freezer, someone else is watching you approach that freezer.
At both UW and SSM Health, only authorized users can access storage areas, which, like the freezers, are locked. More people handle the vaccines once they leave storage, but there are also far fewer doses than back at the freezer.
So if you're going to do something, your impact would be much smaller.
Both systems say they have not introduced new security changes, but the news has led to security reviews.
So every dose is very valuable. So it certainly puts pressure on us to make sure that we revisit our protocols and make sure one more time that all vaccines are stored safely and securely until it's time to get them out and send them to a vaccination site.
We say, what? Could that happen here? And if it could happen here, is there anything more that we could do to make sure it doesn't happen here?
Both sites have the capacity to store thousands. At UW, Dr. Pothoff says they have space for 250,000. But the focus is to get doses into people's arms.
We don't have a ton sitting at any given point in time.
And have as few stored on site as possible.
The tricky thing is you can have very robust security protocols. If you do have, one individual who does have access and you just don't know their intent, it's possible for those people to do some damage.
As Dr. Pothoff at UW Health explained, it's a process of constant reevaluation to make sure that a story like this doesn't happen here.
Naomi Coles reporting live tonight. Naomi, thank you.